Hello Anatomy, welcome to part 2 of our video series for chapter 5, the skeletal system. So in this video, we're going to take a deep dive into identifying and labeling the bones of your body. This one's going to have a lot of detail in it, so let's just get started. So in the beginning of the chapter in video 1, we discussed the two divisions of your skeleton, the axial skeleton and the appendicular skeleton. So just to remind you, the axial skeleton forms the longitudinal or lengthwise axis of your body. It consists mainly of your skull, your rib cage, and your backbone. So your skull, the vertebral column obviously is your backbone, and the bony thorax is referring to your rib cage. Remember, your arms and your legs and your hips are part of the appendicular skeleton. Here we're talking about the axial skeleton. Here we have a front view, here we have a back view. We're going to go through all of these bones in this second video for chapter 5. All right, so we're going to begin with the bones of the skull. So your skull has two main sets of bones. They're what are called cranial bones, your cranium, which is what you think of as your skull. Then your facial bones, which are things like your jaw. All right, the bones of your cranium really aren't movable. Your jawbone, obviously is movable. So the bones of your cranium are joined by things called sutures. Sutures, I'll put the slide back. Sutures are these joints that look kind of like what I'm highlighting here. Sutures are, they're joints, but they're immovable. They're joints because they were two bones meet, but they're immovable because they don't, they're not joints like your elbow or your shoulder. They really don't move. The only freely movable joint in your skull and your face is your mandible, which is your jaw. The skull has a total of 29 bones. Okay, so here's where it starts getting a little complicated. So we're going to go through all the bones of your skull, and we're mainly going to use this diagram. So we could look at, the book has many diagrams of the skull. There's this one, there's this one, there's this one, there's this one, and we're going to look at all of them. But we're mainly going to go through the bones of your skull using this diagram. And pretty much anything that's on this diagram is fair game for a test. So just sit back, just stay with me, and let's just go through these one at a time. And we're going to begin with the frontal bone. The frontal bone is obviously, your forehead. Your frontal bone, the back of the frontal bone has this suture called the coronal suture. It's the suture that connects the frontal bone to your parietal bones. There's two of them, which is basically the top of your head, right? You need to know the bones and the sutures. So the suture that connects the frontal bone, the parietal bone, is called the coronal suture. Kind of divides your head into a front and back half. Posterior to the parietal bone are your temporal bones, and again, you have two of them because you have two temples. It's basically the side of your head. This suture, this between the temporal bone and the parietal bone, is called the squamous suture. Okay. Now the back of your head, the bone is sort of the back of your head or the base of your skull, and kind of like the lower back, is called the occipital bone. The lambdoid suture, this one here, is the one that's between the parietal bone and the occipital bone. Okay, I told you this was going to get complicated, right? All right, so let's keep going. So the zygomatic process is basically, so the zygomatic bone are your cheekbones. The zygomatic process, remember in the last video, things that start with P's or T's are parts of a bone that stick out. The zygomatic process sticks out, and it's where you might have muscle attachments for things like your jaw. Okay, the external acoustic meatus, this little hole right here, that's basically the canal for your ear, where your auditory nerves go to your brain. The mastoid process, you can feel it kind of back here. We're going to do lots of things where I have you touch parts of your face and you move muscles so you can feel them. So the mastoid process is kind of like at the base of your ear, and that bony protrusion connects to muscles of your neck that might do things like this, or it also connects muscles of your jaw, like when you're eating, do that, and you can feel the muscle flexing. All right. The styloid process, you can't feel that one through your skin. It's also a connection for muscles of your neck. All right. Okay, I think we've done everything on the back of the head. So the mandible is your jaw. The mandibular ramus, a ramus just means a lengthy section of a bone, sort of like a lengthwise section. This is the lower part of your jaw. The mental foramen, that little hole, and of course there's two of them, would be a hole for nerves or blood vessels to go like through your jaw into your head. The alveolar processes are where your teeth connect to your jaw. The maxilla is the bone for the front of your face, or I guess what you might call the upper part of your jaw or the top of your mouth. We did zygomatic bone, right? The nasal bones, your nose. The lacrimal bone, so anything lacrimal, I don't know if this is Latin, but that refers to your tear ducts. And your tear ducts drain from your eyes into your nose. They drain down here, which is why if you cry, your nose tends to run because the tears drain into your nose. And there's a little groove in the lacrimal bone where the tear ducts are sort of embedded. The ethmoid bone is behind the lacrimal bone, and the sphenoid bone is behind that one, okay? So I think we've done all the parts of this diagram. In terms of a test, if I give you, I will, diagrams to label, in terms of the skull, I think I would probably use this diagram versus the other ones. Let's just take a minute to discuss the other ones. So I like this diagram a lot, one because it gives you a different perspective. So this is looking at like beneath the skull with the bottom like out. So like you're seeing, if the brain was here, you would see the brain. You're not looking at like the bottom of the jaw. Anytime you see a little hole, that's a space for something to sit in, or a nerve to go through, or a blood vessel to go through. The foramen magnum, this big hole, that's where your spinal column, where your connects to your brainstem and your brain. The jugular foramens, where the jugular vein goes through. This one, the sella turcica, this one's sort of like a little like cradle-looking thing. That's a space where your pituitary gland, which the pituitary gland sort of hangs from your brain, or it's sort of like it rests in the sella turcica. The optic canal obviously is for the optic nerve. We're not going to worry about those words. Yeah, so this diagram, like I wouldn't give you this on a test, but I just want you to recognize wherever you see a big opening like this, or like a passage or an indentation, that is where some feature, a nerve, a blood vessel, a part of your brain, like where it goes through or where it rests. So this is the same view, just with the bottom of the skull included. Like these two are the same. Here you don't have the jaw. Here you do have the jaw. I don't know if there's anything I particularly want to add from this one. I do want to discuss the occipital condyles. So at the base of a skull, you have these two. Again, they're sort of like, a condyle starts with a C, so it's something that sticks out. These two features are sort of going to rest on your top vertebra, which is called your axis vertebra. When we see vertebra in a minute, you'll see where like these two things that stick out kind of rest on top of that top vertebra. If you nod your head, you're flexing there. The carotid canal, that's for your carotid artery. Anything else I want to mention on here? The hard palate, that's the top of your mouth. That's called the hard palate. Like not your gums, like the bony part. Okay, I think that's good with this diagram. Again, just notice how holy the skull is. All of these holes are passageways for things. This is a great picture. I'm not going to use this on a test, but I like it because you can see kind of the bones behind the skull and where your sinuses are. The only thing new that I want to add here, I do want to point out, so you only have the one frontal bone. You have two parietal bones, so one in the front, two on the side. You can see the two mental foramen here. Anything else I want to add to this slide? I don't think that I do. You can see the little lacrimal bone where your tear ducts would sort of rest. Okay. All right, so let's move along. So that was a lot of bones for one diagram, and we've only done the head. So your paranasal sinuses. So your sinuses, quick picture here. You can see sinuses. Basically, sinuses are just hollow cavities in your skull. And they do a couple things. One, they lighten your skull to make it more lightweight, so it's easier to move. And they also, those hollow spaces they're just filled with air. They can give resonance to your voice, which helps to amplify your voice. the problem with your sinuses is they are lined with mucous membranes that tend to be continuous with your nose and your throat. So if you get sick, if you get strep throat, that can spread into your sinuses, and when your sinuses become inflamed like that or infected, it can be very, very painful. You have air in your sinuses, which if that air is under pressure, it hurts. You get a sinus headache, you get sinusitis, you get a sinus infection, because basically all these passageways or most of them are continuous with your nose and your throat. So infections can spread rapidly. Sinus pressure too. You don't really need to know the names of the sinuses. It would be nice that, if you saw these terms, you would know that they're talking about sinuses. Okay. Here's just a side view of the sinuses. I don't know about you, but for me, that frontal one, when I'm sick, that frontal one, and the maxillary one, the one behind my cheekbones, those just do not make me happy. Okay. So the hyoid bone, this is a fun little bone. This is the only bone that does not articulate with another bone. Articulate basically means touch or come in contact with. So the hyoid bone is basically, it's sort of behind and below your tongue, and it's just sort of embedded in the tissues. And your hyoid bone is basically, your book calls it a movable base for the tongue. It's kind of like the back of your tongue where your tongue kind of pushes off from. Without the hyoid bone, the tongue doesn't really have a good pivot point to press off from. Also, when you're talking, when you're swallowing, those movements are kind of based on the hyoid bone. It has these four horns, the greater horn and the lesser horn. But it's just a good Jeopardy question. The only bone that doesn't touch another bone is the hyoid bone. Okay. So, quick little aside on the fetal skull. Quick picture. I know that looks super creepy, right? Looks like an alien. So the fetal skull, first off, when you're an adult, your skull accounts for about 1/8 of your body length. When you're a fetus, when you're in the womb, it's 1/4. So the head is much larger in proportion to the rest of the body than when you are an adult. This word fontanelles are fibrous membranes that connect the cranial bones. So like, if you look at this picture, there's here, you see them here, you see them here. They're also called soft spots. Basically, when a child is growing in the womb and it's ready to be born, the kid's got to get through the birth canal, which kind of smushes the head. And you want it to smush, because if the head can't get through the birth canal, that's a problem. So the fontanelles allow the skull to compress during childbirth. Sometimes when kids are born, if it's a vaginal birth, they kind of have a cone head. The head gets elongated. If it's a C-section birth, obviously if you're a C-section birth, you don't go through the birth canal. They airlift you out, right? They have nice, round, pretty heads. Vaginal births have smushy cone heads. Obviously, the head will reshape later. By about 2 years old, the fontanelles, the soft spots have turned all into bone. It's a little bit creepy, I'll be honest, but with both my kids, like with the soft spot here, before they really got hair, like you could see their heart beating, you could see their pulse in the soft spot, because it's soft. And that, I'm not gonna lie, that's a little bit creepy. Ready for that thing to fill up. Okay, so cool. And again, here you just see it, the bones of a fetal skull, like they're all there, but the proportions don't look quite right. Okay, cool. Okay, so that's enough for the head. Let's move to the vertebral column. So, your spinal column is not just one solid rod of a bone. There's actually little discs called vertebra, and you need the discs because your spinal cord you need it to be flexible. You can bend forward, you can bend side to side, you can rotate, you can pivot. There's actually 24 individual vertebra, and they're separated by what are called intervertebral discs, which is just cartilage. Out of the 24, the first 7 are called cervical vertebra. Remember, cervical refers to your neck. The next 12 are thoracic vertebra, and they're the ones, sort of in your chest, or the back of your chest. And the 5 at the bottom are called lumbar vertebra. And you call these like C3 is the 3rd cervical one. 3T is the 3rd thoracic. L5 is the 5th lumbar one. Okay. This diagram kind of just shows that. So the cervical are C1 through C7, then T1 through T12, and then L1 through L5. The bottom of your spine, the sacrum, are basically 5 vertebrae that are fused, and the coccyx would be 4 vertebrae. This is sort of it's your tailbone. It's the remnant of what, you know, you don't have a tail. Other mammals, the coccyx leads into the tail. We've obviously, you know, humans don't have tails. That's sort of just the remnant of when, from other mammals who have tails. Okay. Okay. And you can see the cartilage between discs. Notice the back has this curvature. The top has a curvature out. As you get to the lumbar area, you have a curvature back in. So this is a posterior curvature. This is an anterior curvature. When you're first born, a baby only has, you know, kind of like a C-shaped spine. As you get older, you develop your lower back, your lumbar curvature. Same picture, just bigger. Okay. Here we have the sacrum, and here we have the coccyx. You can see they're just fused vertebra. Notice the holes. Whenever you see a hole, that's going to be some kind of passage for either a nerve or a blood vessel. You have several cranial and spinal nerves that, you know, feed your whole body. They branch up to the other nerves of your body, and you can imagine, you know, seeing little nerves coming up here and going up through your backbone. Okay. All right, so moving on. So the bony thorax, so your rib cage. Obviously, your rib cage is to protect, you know, your major organs like your heart, your liver, and such. There's 3 parts. There's the sternum, there's your ribs, and there's the thoracic vertebra. So we're going to discuss all of these in a minute. In terms of your ribs, the ribs come in pairs, right? The top ones are called true ribs. Then you have false ribs. Then you have floating ribs. What the difference is, we'll see in just a minute. Okay. Actually, you know, we'll see it on this slide. So your thoracic vertebra, that's just the vertebra, you know, behind your rib cage. Like these true ribs actually touch your thoracic vertebra, which is, you know, here behind your sternum. So your sternum is made really of 3 different bones. So you have this bone called the manubrium, and you can feel it. Feel like where your voice box is. You can feel a bone right here. This thing called the sternal angle, you can feel it on yourself. You know, feel where your throat is, feel that bone, and you can feel where it kind of sticks out a little. The sternal angle. Wow, make sure I say that right. Then you have the body of your sternum, and then you have what's called the xiphoid process. I forgot one thing. The jugular notch, this little notch you feel right here, you can feel it with your finger really easily. That's the jugular notch, then your manubrium, and then the sternal angle in the body of your sternum, and then the xiphoid process. All right. This thing called the xiphosternal joint is the joint. So the xiphoid process is largely cartilage. As you get older, it starts to turn more into bone, but the xiphosternal joint, you can also feel it too here at the base of the body of the sternum. All 3 of these you can feel pretty easy through your skin. So the true ribs, the first 7 pairs, so 1, 2, 3, 4, 5, 6, 7. Notice how they directly connect to cartilage that connects to the sternum. That's why they're called true. False ribs, like look at this one right here. It has the cartilage, but it connects to cartilage from a true rib. So false ribs don't directly articulate to the sternum. And your floating ribs, like back here, they don't attach to the front at all. They're not really floating. They attach to your vertebra, but they're not attaching to the cartilage or your sternum in any way. So true ribs, then false ribs, then floating ribs. Yeah. So intercostal spaces are the spaces between your ribs. Anything else we should discuss on this slide? It is worth pointing out that because like your sternum is so superficial that oftentimes, like if you need to have bone marrow taken to have your blood tested, they might take it from your sternum, particularly the bottom part. And this slide, this is of course a cross section of what we just saw. This is from an actual cadaver. So you see the jugular notch, that's the thing right here. You see the sternal angle, that's, you know, you can feel on the manubrium where it sticks out. They might take bone marrow from your sternum here with a needle. You know, the one caution is that is super duper close to your heart. And if you go too far, you're going to pierce the heart, which means you're going to have a very bad day, and your doctor will have a very bad day too. And obviously here you can see the thoracic vertebra. Okay. Here you're seeing the chambers of the heart and vessels of your heart, like your aorta and your vena cava and things like that. Okay? Actually, I'm not sure the vena cava are on this picture. Those are probably just parts of the aorta. All right. It's not this chapter anyway. Okay, so that's all that I really want to say about the axial skeleton. I think that's probably enough anyway. The appendicular skeleton, we're going to go through quicker. So here we're talking about 126 bones. We're talking about your limbs, your arms, and your legs. The pectoral girdle, which is your collarbone and your shoulder blade, and the pelvic girdle, which are your hips. Okay, so I want to go through this diagram because this is a good diagram that might be on a test. So let's just go through these bones real quick. So your cranium, your skull, your facial bones, we've already discussed those. Your clavicle is your collarbone. It helps position your shoulder. Your shoulder is a great joint because it has lots of rotation, lots of mobility to it, but it's also pretty easy to dislocate. So there's kind of like a pro and a con of having that much motion to it. It means it can come out of the joint pretty easily. Your clavicle helps maintain the right orientation of your shoulder. If your clavicle breaks, your shoulder tends to kind of bow inward. We've done your scapula is your shoulder blade. That's in your back. We've done sternum, ribs. So humerus is the bone of your upper arm. The radius and the ulna are the two bones of your forearm. The radius is always in line with your thumb. So like if you have your arm, like this is your radius, this is your ulna. Like say, well, which one's on top? Well, if I turn my arm, it depends. So the radius is always the one that's in line with thumb. The ulna is the one in line with your pinky, or the one behind your radius. Carpals are the bones of your wrist. Metacarpals are the bones like of your hand, like not your fingers. This part of your hand, and phalanges are fingers. So here's your carpals, here's your metacarpals, here's your phalanges. All right. We did sacrum and coccyx. So your femurs, your thigh bone, right? The patella is your kneecap. The tibia and the fibula. Generally think of the tibia being the one in the front, and it is the one in the front, but your fibula also kind of bows outward a little bit. The big one's the tibia, the smaller one's the fibula. And then we get tarsals, that's your ankle. Metatarsals would be in your foot, and phalanges are your toes. This is a super good diagram to know for a test. This is the same, but just a view from the back. See how with tibia and fibula, like it depends how your leg is oriented, but the tibia is in front, but it's more like the fibula is off to the side. When we do the chicken quarter dissection, you'll see this really easy in the chicken leg. Okay, anything else on this diagram? Just point out your shoulder blades, the scapula. Okay. So the book goes into a lot of detail on your joints, and we're just going to kind of hit the highlights. So joints are classified partly by the structure. Joints that are fibrous are generally immovable. Think about like the sutures in your skull. Those are joints, but they don't move. Cartilaginous joints are ones that are either immovable or maybe slightly movable, like the cartilage between your vertebra. You can move that, but not like they don't rotate all the way around. And synovial joints are the joints that are freely movable, like your arm or your elbow, your knee, things like that. This is just a picture from your book. So fibrous joints, it would be good to be able to name an example of each one. Fibrous joints are the ones that don't move. They're like in your skull. Cartilaginous joints, this is showing like the cartilage between your vertebra or in your pelvis. In synovial joints, like this is your shoulder, your elbow, or like in your wrist, those are the ones that are freely movable. Okay. So problems with your joints. So joints, again, it's a trade-off. Joints are great because they allow for lots of movement, but the more a joint can move, the more moving parts something has, the more you can screw it up. All right. Bursitis. So like in some joints, like your knee, there's a little sort of thin fluid-filled pouch called a bursa, and they're to help cushion your joints. They're great, but they can become inflamed. You can actually burst them, and that's called bursitis. Tendinitis would be the inflammation of the tendon sheaths. Remember, tendons connect bones to joints. That can become inflamed. Arthritis is the inflammation of your joints, and there's many different types of arthritis. It's very, very common as you get older. It's very widespread in the United States. You get pain, stiffness, swelling. Types of arthritis. So osteoarthritis, as you get older, your joints are great, but all those years of wear and tear tend to lead to arthritis. Rheumatoid arthritis is an autoimmune disease. So autoimmune diseases are diseases where your immune system attacks your own cells, which is not by design. And with rheumatoid arthritis, your body is attacking the cartilage between your joints and breaking it down, which causes terrible pain. It can cause deformities. This is an X-ray of a hand of someone that has rheumatoid arthritis, and you can see the cartilage is broken down so much that the joints are disfigured. I mentioned on a previous slide that the curvatures of the spine, the normal ones, the primary one is when you're a baby. Baby is like, picture a baby on its belly. It has kind of like the C-shaped curvature of the spine. The secondary curvatures as you get older and you get in your lower back, you get the curvature kind of back in. So a spine kind of curves outward at the top toward the back and curves inward at your lower back, anteriorly. Here we have 3 examples of different abnormal curvatures of the spine. Scoliosis is when you have curvature of the spine. It can be curved and the backbone can be kind of twisted. Kyphosis, you see this curvature in the upper part of the back. Lordosis, you have more of a curvature in the lower part of the back where it bows inward too much. These can be genetic. You can be born with it. It could be a case where you had abnormal development. Maybe your muscles were pulling on the spine too much that way than that way. But a lot of times it's just genetic. Runs in my family a lot. Osteoporosis. This is a thinning of the bones. As you get older, your bones become brittle. It's more common in women than men. When the bones become brittle, it makes them become fragile and easier to break. This picture, so this one is healthy bone, and this is osteoporosis. You can see the bone starting to get jagged looking and break down. Okay, so that's all we're going to do for chapter 5. I think that was probably enough for actually 2 videos. All right, so I hope that was helpful, and I will see you guys next time.